Thank you, Mr. President. I rise today to share some flashbacks or Throwback Thursdays, if we want to call it that, with regards to Obamacare. A lot of speeches made about Obamacare recently. Specifically, I want to look at the facts about Obamacare as we all know them now, more than 6 months later after, or 6 years after it was signed into law, 6 long years, and remind the country what the President and my colleagues across the aisle promised all of us when they pushed this bill through the Congress. I say push because it passed without one single Republican vote, certainly not mine. First, the reality. All summer long, we have read the headlines about drastic premium increases being requested, insurers pulling out from different states, and patients being caught in the middle. My state of Kansas has not been immune. Last year, United Healthcare announced it would leave our state. Aetna was going to start offering coverage next year, then announced a massive exit from exchange markets across the country, including Kansas. We were at risk of having just one insurer in many parts of the state with no competition with regards to pricing. In June, the state insurance department announced the proposed rate increase for next year. The good news, a new insurer, Medica, was proposing to offer coverage in Kansas. However, Mr. President, there is bad news. The bad news, premiums could be increased by nearly 50% next year for some individuals in our state, and I know in many other states. Last year, the highest approved increase was 24.5%. Next year's rates are still being finalized, but they could be double that. Now let's throw it back. In 2013, President Obama said about the law, the result is more choice, more competition, real health care security. Today, however, we see less choice, less competition, and with insurers coming and going and rising premiums, I think Kansas families would agree they are not secure in their health care coverage. I don't know any state that is. These are not just headlines in the paper or on the internet. Real folks back home are hurting. A nurse in Milton Vale, Kansas, wrote to me about what she calls the devastating effect Obamacare is having on her patients, her loved ones, and she says, I am very concerned that continuing along these lines will further limit care and accelerate a decline in health care in our state as well as in our nation. But again, Mr. President, let's throw back to what we were initially promised. Way back on the campaign trail, 2008, then candidate Obama promised that he would enact health care reform, which would lower a typical family's premium by $2,500 a year. I don't foresee any way those savings could be realized if a Kansas premium is going to be up over 40% on top of about 25% last year. Looking back to 2013, Congresswoman Nancy Pelosi said the implementation of this law was, quote, fabulous. Fabulous, fabulous indeed. This was, of course, before open enrollment started and the failed launch of the healthcare.gov website, which crashed. More issues of concern to me come from recent regulations that have been issued to implement this law. This law contains massive regulations. The law has 2,000 pages. The law has 2,000 pages, Mr. President. We are now over 10,000 pages of regulations. The administration has proposed changing how they verify individuals as being eligible to receive taxpayer assistance for their premiums under the law. Discrepancies between what a person claims their income is and what is received from trusted data sources must now be off by 25%. Previously, it was 10%, in order for the administration to investigate a possible fraud. So I guess you can be fraudulent up to 24.9% now. The administration should not be lowering the standard by which it verifies eligibility for folks to receive our scarce taxpayer dollars. It is unacceptable for implementation of this law to further burden taxpayers by failing to protect against fraud and abuse. Another recent regulation gets at one of my biggest fears from the law's passage, the ability of the government to ration care. There were 4 provisions of this law I believe would decrease individual choice, open the door to rationing, one of which was the Centers for Medicare and Medicaid Innovation, CMMI. Now, in March, this outfit passed a proposal to test, as the agency calls it, how we pay for prescription drugs for our seniors under Medicare Part B. Patient groups, doctors, and many of us in Congress are gravely concerned about how this test could affect a patient's quality of and access to care. As the Kansas Medical Society explained to me, and I'm going to quote here, this so-called demonstration will force Kansas Medicare beneficiaries with serious, sometimes life-threatening conditions to participate, disrupt their treatment processes, and impede their access to needed medication with no evidence of improved health outcomes or financial gains for the Medicare system. Such a so-called test is now allowable because of the rationing provisions of Obamacare. The law is simply not working for the large majority of Americans. Insurers are pulling out, citing large losses in covering the population of people that are seeking coverage on the exchanges. So Americans are left with fewer options in selecting their health care coverage, and most concerning, they're paying more for it, a lot more. Looking back to December of 2015, when this body sent legislation to the president's desk to repeal Obamacare, the president's statement of administration policy stated simply, the Affordable Health Care Act is working. Yet last month, the President wrote in the Journal of American Medical Association that, quote, too many Americans still strain to pay for their physician visits and prescriptions, cover their deductibles, or pay their monthly insurance bills. That's a true statement. Mr. President, thank you for waking up to this nightmare. Despite this new revelation that the Affordable Health Care Act is in fact the Unaffordable Health Care Act for most, the President and his party candidates to succeed him say the answer is greater government control, a public option. Folks, that's government health care. That's what we're talking about. The failings of Obamacare cannot be corrected with more government intervention, more restrictions, and more regulations. We must triage the pain this law is inflicting on hardworking Americans. We must repeal and we must replace this law. I know that many colleagues will join me in continuing to work to provide freedom from its mandates and increase taxes to all and enact reform to our health care system that will actually lower the cost of coverage and increase access to care for individuals. Simply put, this law is failing. It is our job to correct it, and we will continue fighting to do so. I was just talking about this matter in the cloakroom just moments ago. Several of our members who have been very active in this whole endeavor to try to come up not only to repeal but to replace this law gave pause a little bit and say, you know, maybe this law was designed to fail. Maybe this law is so bad in terms of falling apart that people could not help but know that and then come in and say the only thing we can now move to is national health care, government-run health insurance. Mr. President, that's true. That's a 6-year effort with a lot of pain and suffering. And in terms of political deceit, probably rates right at the top. We have to repeal this law. We have to replace it. We have to get to work. And we have to prevent further steps toward national health insurance. Mr. President, I yield the floor.